Hi, my name is Pallavi Kamath. I'm the Executive Director of the Feline Foundation, and with me I have my co-presenter, Dr. Charu Khosla, who's the chairperson of the Feline Foundation. So today we're going to be talking about strategies for long-term sustainability of TNR programs for cat populations in Mumbai, India. So the Feline Foundation is an animal welfare NGO. We were established in 2017. So we work to improve the welfare of community animals in Mumbai with a focus on community cats. So our three strategic focus areas are population management of stray cats, healthcare initiatives, and community involvement. So to date, we've sterilized more than 18,000 cats in Mumbai. We've serviced more than 52,000 animals with our healthcare initiatives, and we've helped more than 28,000 community members with our community involvement initiatives. So just to paint the scene a little bit about what Mumbai's cat population is like, there's no official census. There is an extensive cat population. There was a census done for dogs that revealed that there were around 90,000 or 100,000 dogs. And we estimate that there are 10 cats to every stray dog. So there are approximately 1 million cats in Mumbai, which is a lot. So because there's a big population, they have a high growth rate, a very high death rate, and unfortunately very poor welfare. There's also no distinct cat colonies as such, so they all kind of closely interact with each other. So there's constant migration of cats from one area to another. There's a lot of abandonment of cats that happens when people get frustrated with the cat population in their area or relocation. Cats are also, unfortunately, because it is easy to miss when you go searching for them. And there's few cat-focused NGOs in Mumbai. There's also feeders tend to concentrate a little bit more on stray dog welfare. And there is a government program that does sterilizations for stray cats, but it's relatively new. So to talk a little bit about our cat sterilization program, we follow what we call a zone-wise model, where we sterilize one area at a time so as to stabilize the population in that area before moving on to the next. So this is a way to use our resources more efficiently. So we currently sterilize 500 cats a month, but 200 to 250 of those we dedicate to our TNR project areas, and the rest are brought by community members from other areas in Mumbai. So our current TNR project focus area is Andheri West. So this is the largest suburb in Bombay, around 15 square kilometers. We've mapped this area into 12 zones and then further subzones for easier monitoring and tracking. So some zones are currently active and some are in the maintenance phase. So by active zone, we mean an area where we're currently doing TNR in. So by definition, an active zone is a new area that we have targeted for TNR, where we've completed the baseline survey of the cat population there. It's currently undergoing intensive TNR work to completely sterilize the population. So an active zone tends to have a higher number of unsterilized cats, a higher birth rate, a higher death rate, poor welfare, a higher number of kittens and breeding mothers, and of course the need for intensive TNR, and it requires higher resource utilization to work in that area as well. Once we finish the intensive TNR in the area and that we estimate we've sterilized most of the cats, we do an end-term survey. If more than 80% of the cat population has been sterilized, we then consider it a maintenance zone. So now the focus shifts from high volume TNR to a more targeted response. So in comparison, a maintenance zone has far fewer unsterilized cats because we would have completed the sterilization work. It also has lower birth rates and death rates. It has, however, a higher influx rate of cats who come in from surrounding areas. And it also has higher abandonment rates because from our experience, people do tend to abandon cats in areas where the population is mostly sterilized. The maintenance zone also requires less intensive TNR and rather more specifically targeted drives in certain spots. It does require a lot more intensive monitoring and reporting from community members in the area. So just to summarize, an active zone is a new area in which we're doing intensive TNR, and the goal is to complete the sterilization of the area. And a maintenance zone is an area where we've more or less completed the sterilizations, and now the goal is to prevent the population from rebounding back. So our strategy till date has been to do a baseline survey of a new target zone. Then depending on the survey numbers, we decide the time frame as well as the monthly target for the active phase. So if a population is around 800 cats and there's 600 unsterilized cats, we just say, okay, maybe it's going to take us 8 to 12 months to sterilize this area, and we should target between 80 to 90 sterilizations per month. So we sterilize as much as we can depending on our cat catcher's ability every month. The time frame does sometimes get extended because of different factors. So for once, we're focusing on multiple zones at a time, which makes it a little bit difficult to plan. It also depends on how well the community is cooperating with us. It also depends on our staff availability, surgery schedule, and sometimes that local cats might be too sick for TNR, so we have to pause sterilizations in that area. So once we are confident, based again on the cat catchers reports, that the cats are mostly or all sterilized, we then do the end-term survey. And if the population is more than 80% sterilized, we then shift it to the maintenance phase and we decide new monthly targets for maintenance of the area. So if earlier we were doing, say, 80 cats per month, we'll now be doing 10 cats per month. So this is the status of our Andheri West TNR project as of now. So as of May 2026, we've sterilized 5,962 cats. We currently have 3 zones where we're active or doing intensive TNR. And we have 6 zones where we're doing maintenance, where the population has either been more than 80% sterilized or in 3 zones even 90% sterilized. So our assumption was that now the populations are stable in these maintenance zones and now they'll require minimal TNR. However, our data does not reflect this assumption. So in our experience of the last 2 years, the maintenance work has been more than we initially assumed it to be. So here's a summary of the 6 zones that we currently have in the maintenance phase. We've summarized the data from when they were in the active phase, as well as their data from now when they're in the maintenance phase. So you can see that in each of the zones, we've sterilized more than the number of unsterilized cats that we counted in the survey, both during the baseline and during the end term. However, we're still finding unsterilized cats in these areas. So to take you through one example, if you look at the 4 bungalow zone, we counted 259 cats unsterilized during the baseline survey. And over 14 months, we sterilized 424 cats, so at a rate of 30 cats per month. Then we did the end-term survey once we were confident, and we counted 44 unsterilized cats out of 456, which was great. But again, with us sterilizing 15 cats a month, and we sterilized nearly 60 cats till now, we're still seeing unsterilized cats in the area. So although we were target setting, and although we were also dealing with certain operational logistical problems or maybe community cooperation problems, the timeline and the monthly average still really seems to matter, because you have to look at the population growth rate in each area and not go as per an arbitrary setting. So when we realized the amount of effort that it takes to maintain these areas, we came up with a new trifold maintenance strategy. So it involves data and target setting, as well as a heavy amount of community involvement, as well as a smart allocation of our own TNR resources. So this way we're able to tackle the maintenance zones in 3 ways. So one part of the data and target setting is, of course, the surveys that we continue to do. So the baseline survey that we do at the start tells us the total cat population strength, how many unsterilized, where all the high density hotspots are, where the pregnant and lactating cats are. It tells us the overall health of the population, how many cats are kittens or old or sick or diseased or injured. It tells us how many feeders, where they're located, and how many cats that they help. And similarly, the end-term survey records the same data, and it tells us whether the zone has crossed 80% sterilization. It also points out which areas need the most follow-up, and it tells us if there's been any difference in the overall health of the colonies. And of course, it gives us the data that helps inform our maintenance targets. So since our previous method of target setting based on our cat catchers reports and our field activity was not quite working out for us because it was creating a lot more work for us in the long run, we decided to try out a formula-based system which will help us set monthly targets based on an estimated population growth of each zone, which would factor in the percentage of unsterilized cats, the percentage of fertile females and the rate at which they litter, the influx from surrounding areas as well, which changes from zone to zone, and taking into account the area density, which then affects the accessibility of cats to each other to breed. So basically, estimated growth rate would be the birth rate plus the influx rate minus the death rate. And so our sterilization rate has to be bigger than the growth rate in order to sterilize the population. So here's a formula that we'd set up as a projection for our new active zone, Andheri Station. So the first thing we did was to inflate the survey numbers, because our first mistake is to underestimate the cat population or assume that our survey numbers are accurate. So if there are a degree of missed cats, you definitely want to account for that in your estimation. Then we plugged in the assumed number of females, the assumed percent fertile, the assumed accessibility rate and the litter rate, which then gave us the birth rate, and then we put in the influx rate and death rate that we felt was accurate to the area. This gave us a rough monthly growth rate, and then we used that to set a rough monthly sterilization rate as well. So according to this, we should be sterilizing 129 cats in the Andheri station zone per month, and we will reach complete sterilization in 8 months. This is just an estimate, so this is something that we will try out and see how it goes. It's also easier to not necessarily stick to a strict monthly number for each month, because cat catchers are going to have a much easier time finding higher numbers in the initial stages, and it'll be more difficult for them to find unsterilized cats towards the end of the active phase. So the cat catchers can be encouraged to sterilize more than the monthly average in the first few months, and then that number can lower as it goes on. But essentially, we would want to sterilize 1,035 cats over 8 months. The formula can then be reworked along with its assumptions after the target number of months are done, again based on our cat catchers' field reports and our monthly sterilization numbers. So for the 4 bungalows area, this was our projection for the active phase. So according to our assumptions, even with inflating the baseline and the assumptions that we put in, our monthly sterilization target was 30 cats, and it said that we would be done in 10 months. However, we did actually sterilize 30 cats a month, and it took us a lot longer than 10 months to reach the end term. And even at the end term, we still had unsterilized cats. So that means our estimation of the growth rate was off, and the growth rate has to be re-estimated. So similarly, the formula can also be applied to maintenance zones. So here's the same 4 bungalows area projection now in the maintenance phase. So we put in our survey numbers and we inflated the numbers. We increased the influx rate because it's a maintenance zone. It would have more cats coming in from surrounding areas where sterilization work has not yet been done. We also lowered the birth rate and the death rate because with a mostly sterilized population, there's fewer kittens being born and dying on the streets. And according to this, we should be sterilizing 26 cats per month. We are currently averaging 15 cats a month, so now that we know this number, we can correct it and go on. However, the key takeaway is that although population management is a numbers game, the formula is not a fixed answer. It's a planning tool and of course has to be revised based on actualities.
Next, we come to the community involvement part of our maintenance strategy. We, of course, really depend on the local feeders and the caretakers for their field knowledge. They are the ones that tell us about, the number of cats and how the colonies are doing. We maintain this through a carer collective, which we add all of them onto a WhatsApp group, and we maintain a list of the feeders, a list of the low engagement areas, how many animals are being cared for by each of them. So feeders in the carer collective, they help with both catching and reporting, and catching can be assisted or independent. Assisted catching is kind of catching in which our staff visit the location and the feeders help our staff in catching. So this is helpful with like high density and like low resource areas. And it also depends on the skill of the feeders, whether they are able to catch or not. There are difficult to catch cats where they need the expertise of our staff. And of course, if there are big groups of cats, we send our staff to help as well. The next kind of catching with the community is the independent catching, where of course experienced feeders are able to catch and bring the cats themselves to us. This is helpful in zones with fewer or more spread out cats, less dense areas, and cats that are really known to these feeders as well. Another part of this independent catching is that we've started recruiting paid volunteer feeders. We've started giving a small token of our appreciation to these feeders who were able to bring a lot of animals to us. Now, the carer collective reporting. Feeders are now encouraged, even when we're in the maintenance zones, to help us spot these cats, right? Now, because we've sterilized a lot, it becomes more difficult to find these cats. So we're encouraging feeders to do 2 things. One is, of course, take a picture of the cats and then give us a pin location of the cat. Now that really assists us in prioritizing, so be it our paid volunteer catcher or be it our own staff catcher, as to where they're going to go based on the locations and the images that they put in. In a maintenance zone, the community networks, they tend to become inactive after your active phase is done. So their enthusiasm dips. Now, how do we change that? We change that by giving weekly calls to these feeders and encouraging them to, report any new cats, to bring in the cats if possible, if they spot any unsterilized ones, to even inform us of any, say, local conflicts or any, new abandoned cats that they have spotted in their area. So maintenance is not just about catching cats, but also keeping the information flow coming in from these feeders and encouraging them constantly to keep reporting. A huge part of our strategy, of course, is reliant on feeders. That comes with its pros and cons. Pros being, of course, that nobody knows the area better than the feeder. And of course, they know the migration patterns, they know the new cats that are coming in, they can help us in catching and following up post the sterilization process. But the cons being that not all areas have feeders, right? And some work individually, and there's a general distrust of governmental and NGO programs. But one of the biggest hurdles that we've had in working with them is that they are unavailable during our operational hours. Most of these feeders, they have their daytime jobs and they are unable to sort of bring these animals to us or support us during our operational timings. Another strategy that we've started working with is volunteer scouting, where we encourage the volunteers to walk through all these areas again and again, conducting mini surveys. While they're doing this, they're of course reporting the unsterilized cats to us on a WhatsApp group. They're also distributing and pasting posters about sterilization and our programs, and talking to the locals, encouraging them to report unsterilized cats as well. This is especially useful in areas where there are fewer feeders. We don't just want to rely on our feeders and volunteers, we have to rely on the general community for reporting as well. And we do this through our poster drives, word of mouth, social media, by talking a lot to the local shops, markets, security guards and buildings. In this general community reporting, we try to make the process as simple as possible for the community. So you see an unsterilized cat, you send us a picture and a location pin. The TFF team verifies and then plans TNR for them. We need to be very mindful of where we allocate our resources, which tend to obviously be more towards lower resource areas which have fewer feeders and less reporting and is more reliant on our staff for catching, and areas basically where more self-scouting is required. A lot of our staff's time goes into the active zones, but in the maintenance zones, the first priority is responding to the community reports. So when the community reports through either the WhatsApp groups or our carer collectives about any unsterilized cats or any pregnant lactating cats, so that is the first priority. But in addition to that, our staff are also self-scouting in areas with low resources or with the known hotspots. So they spend a lot of time self-scouting as well. So to summarize, I would say that our staff spends almost the same amount of time in active zones as they do in maintenance zones. So a lot of the feeders, when we meet them in the carer collectives, we realize that they are very underconfident in catching or trapping cats. So we are constantly trying to build that confidence and teach them new methods and techniques of how to trap and use some of the equipment that we have and build their confidence towards trapping the cats and reduce our staff's resources. So to summarize, what we've learned is that the maintenance planning needs to start before the active phase ends. You cannot plan it after. The sterilization targets and timelines need to be set, and they constantly need to be checked against ground realities. The knowledge of the areas and the communities and building those carer collectives up and encouraging them is another very, very important factor, whether your maintenance strategy will work or not. And, there are different strategies that need to be applied for high resource areas as compared to the low resource areas. Better resource acquisition in general, more catchers, more volunteer catchers, more traps, a better transport methodology. All of these are ways in which we can long-term maintain and sustain a TNR program. With this, we conclude our presentation. Thank you so much for listening.